Wait 1 second. I think we started early last time.
Okay.
Hi, everybody. Thank you for joining us. We'll be starting in about 5 minutes, just to give everybody some time to join in. So if you want to grab some water or some snacks in the meantime, feel free. We'll be back in 5 minutes.
All right. See you in a second.
Okay.
Okay, guys, we'll go ahead and get started. Of course, hey, thank you so much. Welcome back. We really appreciate you all being here. This is going to be a really good session. We're super excited for it. pain management is like super underrepresented field. So we're really excited. I feel like a lot of people don't know enough about this, especially in the PA world. So this is going to be really cool. Just a few quick notes as always. Quiz info will be at the end of the session. We'll post a link in the chat, and then nothing tricky. Just answer 4 out of 5 questions correct. Just to kind of make sure you're here. You'll have an hour to do it, and we'll email you that certificate. Aside from that, just stay active in the chat, guys. We'll be taking down all of your questions, and we'll kind of relay them back to Fabienne whenever she's ready, and be able to answer those questions for you. So yeah, we want to hear from you guys. I love all the side conversation and see you guys talking. So please, we promote that. I think that is everything. So Fabienne, whenever you're ready.
I am ready.
All right.
All right, so hi everyone. My name is Fabian. I am a pain management physician assistant. Also, if you guys hear me speaking strangely, I have like brackets in my mouth, so please bear with me. But anyways, I just wanted to come and talk to you guys today because I know it's super hard to get shadowing experience during this crazy time. So feel free to ask me any question as we continue with this. So I am ready, guys. You guys can switch to the next slide. Okay, so a little bit about me. I was born and raised in South Florida, and I'm still actually here. I went to the University of Central Florida, that's in Orlando, Florida. If anyone has ever been to Florida, I saw a couple of people in the chat are from Florida. So I graduated in 2015 with my bachelor's in health science, and I was on a preclinical track, which is basically a pre-med track. So I did all of the courses necessary in undergrad. So of course, that's not the story for everyone. Some people have to take classes after if they have a different major. We could talk about majors later as well. So I took a gap year. I ended up working in labor and delivery at a hospital in South Florida. I actually was able to get trained and work on a floor in that hospital. I could talk about that later as well if you guys want to. So yeah, I worked as a patient care tech there. It was very different compared to other patient care tech jobs. And yeah, it actually was what I did to get hours. And then I ended up attending PA school at FIU in Miami. So yeah, and I graduated in 2018. So we can go to the next slide. Okay, so things I like to do for fun. Okay, I see some Knights in the chat. Go Knights. Things I like to do for fun because, of course, PA can't be your only life or things that you do. So I like photography. I've been getting into photography lately. I like brunch, painting, watching action movies. I love action movies. That's my favorite. And of course, I like reading as well. So yeah, we can go to the next slide. Okay, so pain management. So to be completely honest with you guys, I never saw myself getting into pain management. Reason being, you don't really get exposed to pain management in PA school unless you decide to do that elective, because you get to choose your own electives in PA school. They give you 7 core rotations. So like, of course, emergency medicine, family, all that type of stuff. And then you choose your 2. Mine were dermatology and urgent care. And then, you go about your day. So I kind of stumbled into pain management. And so far it's been pretty good. I've been working in pain management for a year. The things I like about pain management is, of course, it's problem solving. You have to talk to your patient, see what's going on. You do outpatient procedures. So people who like to do procedures, you don't necessarily have to go into surgery. You could get training in ultrasound. So if you're doing trigger point injections, intra-articular injections, you do that with the ultrasound. You, of course, you do that with the ultrasound. Of course, you interpret diagnostic studies. So of course, that's like different. With a lot of people, they come in with pain because they're having like problems with their backs and stuff like that. So we'll order an x-ray. That'll tell you what's going on pretty much. You do physical exams. And I would add that pain management is one of the higher paying salaries in our field right now. So people are getting paid very well in pain management. And that's all I'm going to say about that. All right, so the next slide, we can go to the next slide, please. Okay, so these were the other specialties that interested me. Like I said before, you have to do core rotations, and you also get to do specialty rotations. So the main specialties that I liked were emergency medicine, pediatrics, dermatology, and family medicine. Most of these, as you can see, pediatrics, emergency medicine, family medicine, you get to see so much. So you're going to see that once you guys are on your clinical rotations, you get to see so much, meet different people. So I loved that. What I loved about dermatology is that it's just very relaxed and chill, which pain management is too, and we'll get into that. So yeah, those were like some of the specialties that I liked. I'm trying to see. I took one gap year for people who are asking. And if you see me looking away, it's because I'm also looking at some of the comments that you guys are leaving. Okay, so we could go to the next slide. I'm going to try to answer some questions as well. I graduated college in 2015. I started working as a PCT, a patient care technician, in 2015, stopped in 2016. So that's 1 year. 2016 is when I started PA school, and I ended PA school in 2018. So 2.5-ish years of PA school and 1 gap year. Okay, so disclosures. None of this is a representation of my employer. These are all my views, my opinions. So just to get that out of the way, we can go to the next slide. Okay. Someone said, how hard is it to get into pain management? It actually, to me, I think it's one of the easier specialties to get into. It's one of the specialties where people are actually taking new grads all the time. So that's kind of how I ended up in it, because my physician was willing to train me. And I've seen that for a lot of pain management positions. How was the experience working labor and delivery? Okay, I'm going to answer that kind of at the end because it's kind of long. Okay, so for the first presentation, I have a 22-year-old male. So it was a 22-year-old male who came in with a motor vehicle accident. So you're going to see these like acronyms and stuff in PA school, and that's basically what that stands for. So a motor vehicle accident. So he came in complaining of neck pain, upper, mid, and lower back pain, bilateral, so BIL, bilateral, both shoulders were in pain, right knee pain, and headaches. So we can go to the next slide. Okay, so when a patient first comes in, and they're telling you like, okay, I got into an accident, or I fell off of a ladder at work because they do construction, or anything, they're coming in for pain. We still do the same vitals that everyone else does. So of course you get, blood pressure, heart rate, respiration, temperature, all that. Sometimes if they have like a high blood pressure, we'll recheck it. I'll sometimes give like a low or short course of hypertension medication and make sure they go see their primary. But yeah, we still do like the basic things. So when they come in, we have to do a physical exam in PA school. That's one of the things you're going to learn in the first year, how to do a proper physical exam. There is like a general physical exam that you work up every body system, but for pain management, we particularly do like the muscular system and skeletal system, or what they label as musculoskeletal. Okay, so when the person comes in, we have to do range of motion. So range of motion is just to see if they're still able to like bend their neck, bend their back, bend certain ways in as many degrees as a regular person should. So a regular person, when they are flexing forward, or extending, they should have a degree. So for flexing, if I'm flexing, going down, trying to touch my toes, I would probably be 90 degrees. So that's when you start seeing different for people who have been in accidents or suffered something with their back. They have different degree of flexibility, and we of course have to document that. So cervical, for the people who haven't done like anatomy or anything like that, that's neck. Lumbar, that's the lower part of your back, the lower spine. So we do range of motion for that, just so we can see, like I said before, to see how your flexibility or your range of motion has changed. So for this person, he came in with a cervical range of motion. His extension was 35, flexion 40, lateral and right, I mean left and right, because that's basically what we make them do, go to the left, go to the right. And we actually have like a small machine for it, tool for it, and it'll tell us, you know, what the degree is. So all of his range of motions were normal technically for the cervical spine. For the lumbar spine, that's when we started to see that, okay, he's losing some degree of flexibility. As you can see, how I was saying before, I would probably have a 90 degree for flexion, which is the F, when I put F on there, for lumbar spine, he had 55. So that was already an issue. So we have different signs that they make us do. So like I was saying before, you do a physical exam. So for our physical exam, we do the Sperling sign test, the Soto test, Kemp sign, straight leg test, near test, all that good stuff. You guys are going to learn about that in PA school. It's a lot, but you'll end up remembering like the main ones that you need to know how to do. So the Sperling test is basically when I apply pressure on someone's head and I either bend it down and then I hyperextend. And then that's basically to see if that elicits pain. The Soto test is kind of similar. I have them lay down and then your arms are basically crossed over, and I push down their head as well. So just different signs like that. So as you can see, he was positive for most of these signs, which indicates a sprain. So the Sperling sign and the Soto sign are for the cervical area. So that basically just showed that he had, it's a high likelihood that he has a cervical sprain. The Kemp sign, straight leg test, the NEARS, Kemp sign, straight leg test, that is typically for the mid and lower back. So that also showed that he has a likelihood to have a lower back sprain or strain. And the NEARS and Hawkins signs are for your shoulder. So again, you're also going to learn that in PA school. So the Hawkins impingement test, the NEARS test, all of that. So he was positive for that as well, which means it is a high likelihood that he had a rotator cuff or shoulder injury. And then Latchman sign, that's one of the tests that you can do to see if someone has a knee sprain or strain. You can go to the next slide. Let me see what you guys are saying. Does the supervising doctor train? Okay, so someone asks, in a pain management clinic, does the supervising doctor train you to do the procedures, and our PA is allowed to do spine procedures? Okay, so they supervise you when they're first teaching you how to do certain things. So like I said, you can do trigger point injections, intra-articular injections. So initially when they're teaching you, of course, they're going to be standing over you because they want to make sure you're doing it right, of course. But after that, you'll pretty much be doing everything by yourself. Like I pretty much go in every day and I don't want to say do what I want, but pretty much do what I want. Do my own thing, and I go about my day. Like if I have any questions, then me and my doc will talk. Sometimes I'm in the office just by myself, and I'll either text or call him. But you have a lot of autonomy in pain management. The exam sounds very similar to something an orthopedist does as well. Do you think they are similar? They can be very similar because if a patient can't be, I don't want to say cured, but basically cured with pain management techniques, the next thing would be to advance them to surgery, which would be with an orthopedic. And then you'll have some clinics that are an orthopedic clinic / pain management clinic because a lot of things run in together. Is there a checklist that you go through when you're examining patients? Yes, in my mind. When you're in PA school, we have actual checklists that they give us. It's literally like multiple pages where you will have to make sure you're checking off all of these things. So did you auscultate the heart? Did you auscultate the lungs? Did you look at their eyes? Like all of that. But currently now in my practice, it's such a routine now because I do it all the time that it's in my mind and I'm like, okay, I did this, I did this, I did this. They're coming in with a neck injury, so I'm going to do the SOTO test, I'm going to do this, so stuff like that. So it comes like a routine. It ends up being, I don't want to say easy, but kind of easy. How do you know what degree is normal or abnormal? Okay, so you could kind of look it up, but in PA school, they taught us that. So that's the only reason why I knew what is normal. And then it will like in PA school, it will say, okay, 30 degrees to 45 degrees is normal for flexion of the cervical spine, stuff like that. Don't quote me on the numbers, but yeah, actually that's correct, but stuff like that. So you will actually find out the exact numbers. And to be honest, when you're out of PA school, there's still a lot of stuff that you don't know. So you still just have to look it up, find out, ask your doc or ask other PAs in the office and stuff, and then you'll be okay. Like don't be afraid to ask when you get out of PA school, because trust me, there's still so much you don't know once you get out of PA school. Was going to ask about autonomy. Oh, okay, yeah. So yeah, answer that. How did you apply to be a PCT? I'll answer that later because it's kind of long, guys. What's the difference between pain management and physical therapy? Great question. Okay, so physical therapy and pain management, they're different because with physical therapy, you're not prescribing any medication. With pain management, which you guys are going to see with the next case, you are actually prescribing medications, and it could either be something as simple as ibuprofen or something as far as a Percocet. In physical therapy, that's more like personal injury, and you can prescribe medications, but that's not what they're there for. They're more so there to do different like techniques to try to stop their pain that doesn't necessarily involve medication or managing their pain through medication. So just to jump back into the presentation, the guy who we were just following, the 22-year-old who was in the motor vehicle accident, of course, after doing the physical exam, you have to do imaging next. So for him, of course, I needed to do x-rays because I was telling you guys that I think that he has a cervical sprain, a lumbar sprain, both his shoulders, one of his knees. So I went to do an x-ray just to see what is going on. And just to let you guys know, x-ray is the first line modality. And basically what that means is before going to other imaging processes, they like to just get an x-ray first. Why? X-ray is one of the cheaper options. So you're going to learn in PA school that some things they're just going to jump straight to an MRI or a CT because of how pressing the issue is, or whether it's life or death. But for the most part, they like to start with x-rays because that will tell you the basic issues of what's going on with the patient. So if I got x-rays back and let's say the x-rays didn't show anything, then I would, and the person is still saying they're in pain, X, Y, and Z, then okay, next I would advance to getting a CT or something like that. So yeah, for this patient, like I said, you can prescribe in pain management. That's one of the things that we do. I just gave him ibuprofen 800. So typically what we start at, because there's basically a scale for everything. we start at ibuprofen 800. So that's probably one of the things that can actually maintain a lot of people's pain, because some people don't like taking medication all the time. And ibuprofen is just one of those things that's safe for most of the population. So that's why we start with that. And I just gave him that and he was good with it. He's 22. So yeah, we can go to the next slide. Okay, so after everything came back, it was, we basically found out that he had a cervical sprain, thoracic sprain, lumbar sprain, bilateral shoulder sprain / strain, because it dealt with the rotator cuff. Again, you guys are going to know more about the MPA school, or if you've taken anatomy and physiology, you probably know about that now. Knee strain, and post-acute traumatic headache. So a lot of people, after they have gotten into bad accidents, they end up experiencing headaches more frequently than they did before. And these people have gotten CTs, MRIs. It's not showing anything in their brain. It's just honestly because they're having traumatic headaches after that accident. And he was one of those people. So for him, we basically did therapy for 12 weeks. So he came into the office because one of the offices that I work at, we also have chiropractors there. And the chiropractor follows them as well. So treatment for 12 weeks, he would come into the office 3 times for 12 weeks, follow up with the chiropractor, do physical therapy. So that's basically what happened with him. He was good after that. He's 22. He bounced back pretty quick. So he was pretty good. So you guys can switch to the next slide. Does your clinic have a pharmacist? No, our clinic doesn't have a pharmacist. We don't necessarily, actually not at all. We don't call a pharmacist unless I'm calling into a pharmacy and I'm asking a pharmacist who is a doctor, I'm prescribing this for my patient. I'm calling in X, Y, and Z medication. This is how much I want to give them, that type of thing. But there's no actual pharmacist on site. Do you generally do a CT if a neck injury is indicated? Okay, so it depends. Sometimes, of course, people come in, let's say how my other patient was in a motor vehicle accident. After their accident, they're already being taken to the emergency room or an urgent care setting. So they have to do half of these images that I'm talking about. So a lot of times we'll just get the images that they already took at the emergency room, so they don't have to keep getting x-rays and CTs done over and over and over. So yeah, a lot of times we already get them from the emergency room or the urgent care that they went to. Okay, the person says CT is x-ray images taken at different angles, but MRI is a magnetic imaging of soft bones and tissues. Yes, correct. Soft tissues and bones, yes. How long does acute traumatic headaches normally last, or are they permanent? I haven't seen anyone permanently have them. For the most part, I've just seen, the longest I've seen is a month to 6 weeks. So not too long, but kind of long. To a chiropractor or versus the physical therapy. So the way we kind of choose is, we don't choose because they're still doing physical therapy and just seeing a chiro. So we have the chiro actually already in our office, physical therapy already in our office. So they end up doing both. So it's basically like a multifactorial treatment process. So you're going to see us, whether that's a PA or a physician, see the chiropractor, and do physical therapy. That's just it for everybody. So yeah. Have you assisted with ablations? Only on my surgery rotation, but not at my current job. When would someone go to PT? Okay, someone said, when would someone go to a pain management instead of another type of clinic like PT. Some people have like long-lasting pain. So let's say I got into an accident today, and a month later, I'm still complaining about this pain. And I'm already doing physical therapy. I'm already trying to put ice packs here and taking Advil pills, because some people are popping 3 Advil pills, nothing's happening. And it's like, okay, that's when someone's like, okay, I'm going to refer you to pain management, because clearly we cannot manage your pain regularly with just therapy or with just over-the-counter medication. So that's kind of when someone ends up referring them to a pain management office. So for the second presentation, and I'm going to answer like way more questions when we end up finishing this presentation, because I know it's quite a few and I kind of missed some. Okay, so for the second presentation, there was a white 32-year-old male, and he was complaining of neck, back pain, shoulder pain, muscle aches, knee pain, bilateral arm pain, so both his arms and both of his legs. So he told me, and this is key, guys, because when you're getting information from your patients, you have to listen to what they're saying and really follow everything that they're trying to tell you. So he said he fell from the roof because he's a construction worker. He owns a construction company. And he said that he was taking Percocet for pain relief. So, of course, if you guys don't know, there's a huge opioid crisis going on now in the United States. So, of course, I had to ask him, like, okay, so where are you getting this Percocet from? What's going on? He's like, oh, one of my buddies, AKA one of the guys who works for him at the construction site, he's been giving me some of his Percocet because he knows how much pain I'm in, and it's just excruciating. So I was like, okay, understandable. So I'm still gonna have to do a physical exam for you, like I do for everyone else. I was just telling him, like, okay, we're probably gonna have to get some imaging done. You know, basically the spiel I give every patient. You can go to the next slide. Okay, so this guy, of course, we did the vital signs again. So vital signs were pretty much normal. If you guys, I don't know who knows what's like the proper vital signs or not, but basically these are all normal. And then of course I did a physical exam for him as well. So if you notice in this physical exam compared to the last physical exam, a lot of the signs were negative, which, okay, these tests aren't always like 100% foolproof, but for the most part, they are, correct. So for the most part, all of these signs were negative. So I'm just thinking like, okay, this is a person, this is how you have to think when you're a provider. This is a person who's taking Percocet. I don't know, maybe he took a Percocet before coming here. That's why he didn't have any type of pain when I was doing this physical exam. But when I'm talking to him, he's saying like, no, I have pain. My pain is a 10 out of 10. I don't care. You need to prescribe me Percocet. Basically, he started like ranting and raving. And I added this presentation, I guess, because I wanted to show like the, I guess, bad side of pain management, because I don't want to like put rainbow mirrors or like, glasses on you guys and make it seem like it's just like the sweetest thing ever. But you're going to get a couple of patients when you are in pain management who are coming there literally to seek drugs. Like they're coming in there because they want drugs, and that's pretty much it. So you're going to have like kind of people who are like a bit abrasive, and just really like confrontational about these drugs. So his drug of choice, of course, was Percocet. So I'm just like, okay, sir, I'm doing all of these exams on you. You don't, I don't know if you really have 10 out of 10 pain, but okay. So I was in there talking to him for maybe like 45 minutes. And when I say, guys, he was my last patient as well. So I thought I was going to be out of work like at 6:30 that day. I didn't leave until like 7:40 because of course I had to document all of this, everything else. But yeah, he's like going toe to toe with me, and I'm trying to explain to him like, either way, I still have to do this and this and this on you. So finally, I'm able to talk him down. He comes off of a ledge, and we reach like a middle ground. So of course, before you prescribe anything to any patient, you have to find out if they're allergic to anything. You have to, especially if you're giving like a narcotic. In Florida, it might be a different name for other states, but in Florida, it's called eForce. And basically, eForce is like a central system that you can basically type in a patient's information, whether it be like their social or other identifying factors, and it can show what other doctors have prescribed them medications. So you have to do that, or you should, I said, it's good medicine to do that and make sure you cover your bases with everything, because I'll actually bring that in later. But yeah, cover your bases with everything. So we met a middle ground. I said, you know what, this is what we're going to do, because he actually was seeing another pain management physician, and he was supposed to be getting trigger point injections from this other physician that he was going to see in 2 days. So I said, okay, you know what we're going to do? I'm going to give you 2 days worth of Percocet. You're going to see and follow up with your other pain management physician, and you're going to follow up with our chiropractor and do physical therapy with us after pending his imaging. Oh, you guys can go to the next slide as well. Sorry. So this is eForce, what I was talking about in Florida. It's the prescription drug monitoring program or whatever. And of course, I had to like verify everything else. That's what you're seeing on this slide. So I get a call the next day. The next day I was off. And like the medical assistants who work at the office I was at that day, they're calling me. They're like, the patient you saw yesterday told me his name. I was like, oh, okay, yeah, I do remember him. What's going on? Well, the pharmacy can't give him the medication. I was like, okay, why? What are they saying? Apparently, this guy has tried to get Percocets, which is basically called drug shopping, prescription shopping. You're going to see a lot of terms for it. But he was trying to, he basically got another prescription, or tried to get another prescription along with my prescription in the same day, and was trying to take both of them to the pharmacy so he could have, like, I guess, double the supply of Percocet. So, of course, that's what the pharmacist is telling the medical assistants. I'm like, oh, wow. Okay. So this is my day off. So again, I'm trying to tell you guys, like, it's not going to be all peaches and cream sometimes. And I'm like, okay. So the pharmacist calls me. I'm speaking with the pharmacist. The pharmacist is like, yeah, this person has a history of doing X, Y, and Z. I'm like, okay, noted. So this is all basically just to say, oh, you can go to the next slide, I think. Yeah, so drug shopping, stuff like that. This is all just to say, in pain management, you're going to end up getting some people who they can actually very much be in pain, but their main thing is not to relieve their pain, it's to experience a high or to have that medication. So you just have to be very conscientious of that. So like I said, one of the main ways of dealing with that is listening to what the patient said. So him saying that he and his friend were sharing medication, especially something as big as Percocet, that's crazy. The fact that when you're doing a physical exam and there are certain things aren't eliciting pain, that's kind of a giveaway. The fact that he's adamant on what prescription you should give him, not just saying, hey, doc, I need something, or hey, whatever, I need something to alleviate my pain. No, I want oxycodone. No, I want hydrocodone. No, I want perks. No, I want morphine. When people come in and give you directly what they want, that's also like a big indicator that there's something going on here. Because like most people don't even or haven't even experienced taking a certain narcotic, especially if this is your first time ever falling off of a building or anything, getting into an accident. So for him, of course, we ended up thinking that he was drug shopping. So you try to get these people to enter counseling, like different type of substance abuse, try to get them a therapist or to also see a psychiatrist so they could do like different detoxing methods. But of course, this person, I put lots of follow up because basically after that, he went ghost. He wasn't doing counseling. He wasn't trying to basically be in the system. I know for sure he's probably at another clinic or trying to see other providers at this point, trying to maybe find a way to get medication. So for those people, you just have to kind of really watch out for, again, if you end up getting a DEA license. And basically, guys, a DEA is just what gives you like, I guess, legal permission to write narcotics and certain scheduled drugs. So a lot of PAs don't have DEAs because certain specialties, you're not going to need it. Pain management, of course, you end up needing it. Emergency room, psychiatry, PAs, but stuff like a lot of like peds PAs, derm PAs, stuff like that, they don't even have DEA licenses, or they end up writing under their doctor. Because in Florida, you can actually use your supervising physician's DEA license. In other states, you cannot do that. So you have to get your separate DEA license if you're doing that. And your DEA license is separate from your actual state license. So you have to pay two different fees. DEA license is like $736. And then your state license could be like from $200 to like $350, again, depending on your state. We can go to the next slide. Okay, so yeah, so these are a couple of tips that I basically put in here for everyone. And it's just becoming a PA could be like a very trying time. I don't know what's like it's not even like a certain age group, because I know some people aren't like traditional PA students, but because I kind of wasn't a traditional PA student myself, but I guess I entered the program a bit younger. And I just want to say that becoming a PA is going to be like a very trying time. Being in PA school is just very trying. So just enjoy life prior to PA school. Make sure you guys really just like just enjoy life, because PA school can be very, very trying and tiring. Don't give up on your goals. A lot of people after they see, because I had like a mentee. I'm not going to say all of her information, but basically I think she was like really seeing that it was difficult to, get through some of the classes with PA school. And it was kind of difficult to get into PA school. And, sometimes you become discouraged, but I just want people to know that even if you think that you have like a trash GPA or like a super low GRE score, or your hours aren't there, like you never know, you might actually get accepted. And you should just keep trying to push yourself. That goes in with finding like-minded people. So with me, a lot of my friends are like nurses, physicians, optometrists, pharmacists. So I had like a lot of like-minded friends, ended up doing a lot of classes with them, and it really motivates you. So it's like you should really try to find like a group of like-minded people who can really, push you when you're feeling discouraged and sometimes you're feeling down. And that even goes with PA school too. In PA school, I had like a PA best friend. We're still like best friends to this day. I talk to her almost every day, just because you get so close to certain people in PA school, because not everyone's going to understand what you're going through and how hard the program can be. And yeah, her and I would just like really vent to each other. We had crying sessions. And even now we'll talk and we'll say like, oh my gosh, I had a patient today, and she'll like bounce off of me and I bounce off of her. So just getting like-minded friends and like-minded people is like a big thing that I suggest to everyone. Be prepared to work long and hard. As I've been saying a million times, PA school is just rough. Like, it's nothing like undergrad. You're literally there, especially during didactic. Didactic to me was the worst ever. That probably was like one of the worst times of life for me, but you're literally in school from 9 a.m. to 5 p.m. That's for my program. I want to say for Miami-Dade, some people would say they were in class till 7 p.m. a lot. So yeah, you're going to be in there for the long haul, but just remember it is 2 to 2.5 years. So it goes by super quick. Like, I've been a PA now for 2 years, so it's been crazy. It just 2 years flies by. So it's going to be hard, but definitely worth it. And yeah, so you guys definitely deserve this. So just keep high spirits. I know it's hard to say, but I just want everyone to keep high spirits, and just, you know, try to remain motivated, and just know that the PA profession is great. We're the #1 career right now. And we were like 2 years ago as well. And that's just because of like the high job satisfaction that you can get and lifestyle. So just keep pushing forward. And I just put my Instagram page at the bottom if anybody did want to follow my Instagram page, because I do post things about like my actual PA job there now, and just some tidbits about PA school, pre-PA, and post-PA life. So I'll definitely answer questions right now. And let's see. Okay. I strive for those kind of friendships. Yes, I love my PA best friend. She's literally a ride or die. I'm telling you, it's great. Have you ever had a rotation that made you want to choose a different profession? Oh my God. Okay, so guys, I think I'm gonna actually do a video about like my worst and best rotations and my worst and best job interviews. But for sure, I will definitely say one of my worst rotation. My worst rotation, guys, was urgent care. And it's not because I hate urgent care, because I love urgent care, but it was because of the actual preceptor. So when you guys go to rotations, you'll be assigned a preceptor, or sometimes you'll be assigned like 4, depending on how the schedule is. So 1, 2, 3, or 4, it could be arranged. But I was with one preceptor in urgent care, and this man gave me a run for my money. He was on my neck every day. When I say every day, that's what really made the rotation like very hard for me, because he would even ask me questions and I would answer, or I would like try to look it up, and he'd be like, no, like a very just nasty and short. So you're gonna get some preceptors that are just very like nasty and just really like ride you. But you just have to remember these rotations are like 4, 5, 6 weeks. So I got through it, but it just made me feel like I can't, like I really don't even know if I want to do this anymore. But that was just the actual preceptor. It wasn't anything to do with urgent care or the PA field. How many PC hours did you have before applying to PA school? I had 500. So for FIU, they had like rolling admissions. So I didn't catch the first wave, but I caught the second wave, because I was like, okay, let me just try to get some hours under my belt. So like I told you guys before, I was a patient care technician, and I started in June 2015, because I graduated in May of 2015. So I took like a little 2-week break, started looking for jobs, found that job to try to hurry up and get some hours in. And even though a lot of places were saying like 2,000 hours, you needed 2,000 hours, I was like, I'm just going to bet on myself. I don't care. because if I could get in this year, I don't want to have to wait another year. I don't want to be a patient care tech for another year. So let me just apply with these 500 hours. And I ended up applying with those 500 hours. And of course, by the end of the year, before actually entering PA school, I had like 1,000 hours. That's like a full year of working. It's like 1,000 hours. So yeah. What are some things you got involved in that made you a better applicant? So I was in the Pre-PA club at UCF. I did a family medicine internship at Florida Hospital in Orlando. And I did that for a spring semester, my junior year of college. So I was following family practice DOs and PAs. I did things outside of PA school. I mean, outside of like medicine, because you don't just want to be a heavily, like your application is heavily just medicine and they don't see anything else in you, or they don't see that you're a diverse candidate. So I was in a couple of community service-based organizations. I did a couple of like, sisterhood type of organizations, because of course, like you still want to have fun and like do different things in colleges. So that's what I did. I applied to 5 schools. So whoever asked me how many schools I applied to, 5, because like I said, I didn't really have a lot of hours, but I was like, okay, I'm just gonna try to put myself out there to see if I even get accepted. And FIU was my #1 choice at the time, because one, it was one of the cheaper schools, and it was like close to home, so it was just going to work out for me. Now FIU is like kind of expensive, or as expensive as the other ones, but it was like way cheaper when I first started or looked at PA schools. What kind of things were you guys doing in the PA club? So the Pre-PA club was great because they actually had people come in like this. Well, not necessarily always do cases, but they would have PAs come in, talk, basically give you a feel of the PA profession. Those PAs sometimes would be able, you could talk to them after the session and possibly get like shadowing opportunities. You would meet other people. This is where I was saying like meet like-minded people. So I met other people who wanted to be in a medical field. So it's like, okay, I would be able to become friends with them, see them in a class, and then be able to study with them. Or if I didn't make a class, kind of get notes from them, bounce off ideas. So it's great for networking purposes. Like that's one of the best things Pre-PA club did for me. Okay, so yes, how did you find the PCT job without a certificate? Okay, so when I was graduating undergrad, I was just like, okay, I need to try to get these patient care hours. This is the only thing that's holding me back. I have all of my prerequisites. I did the GRE. I had people who wanted to write me letters of recommendation. So really the only thing that held me back from not even trying to apply to schools my senior year was my hours. So I just started like the month before I was graduating, literally sending out, applying like crazy on Indeed. I would just put jobs you can have with a health science bachelor's job, stuff like that. Just different, I would input different things into Indeed. So finally I ended up stumbling on this job where or this hospital where they actually train you. They give you a 3-week training program. And that training program is paid. And it's basically to show you how to be a PCT or clinical assistant, CNA. It had different names, but all the same thing. And I was like, okay, great. It was back home because of course at that time I was in Orlando, and I was like, okay, whatever, I'll just move back home. I got to do what I got to do. So I ended up moving back home, started that program at the hospital. They trained me for 3 weeks, and then they actually place you on a floor. So the floor they originally placed me on was med-surg. I hated it. I was just like, this will never, like, I really have to get into PA school because this could never be my life. Like, I just really have to get into PA school. And then finally, but that was like part-time. So then I saw that the labor and delivery floor had an opening for full-time. I talked to the HR manager. I was like, look, I really want this job. Can you try to get me in? She let me get an interview with the nurse manager on the labor and delivery floor. Luckily, the nurse manager and the director, they loved me. So I was able to work on that floor, do labor and delivery floor, mother baby floor. So that was like way easier and such like a sweeter patient care tech job. So I guess I would just say you should try to like look at different hospitals in your area to see if they do that, or if they accept people who, because you could also go online, I think, well, for Florida, and actually like just take the test and you get a certification, and then you can just like go work at a hospital and try to find a patient care tech job that way as well. But that's kind of how I did it. So any advice for trying to find PA or PA student mentors to help with writing the personal statement, filling out CASPA mock interviews? Okay, so sometimes it's kind of hard because of course, like some PAs have like super busy schedules. So it's kind of hard to say like, okay, I need this, and this. And some people are going to be like receptive and some people aren't. But a lot of people, like my mentee, she reached out to me on Instagram. I loved her vibe. She likes my vibe. And we just ended up being like having a good mentee mentor relationship. So I feel like one thing you can do is probably try to reach out to people online or like in different spaces. That's why I said try doing the pre-PA club or even looking on LinkedIn. Several people have tried to reach out to me on LinkedIn for shadowing opportunities, but right now, guys, it's very tough. Like my supervisor isn't letting anyone shadow me, and that's for a lot of providers right now, but you should just still try and give it a shot. So LinkedIn is a good way. Social media is a good way. And of course, like I said, networking at different clubs and organizations. I'm a PCT for a med surg floor right now. I feel your pain. Yes, it's so chaotic. Okay, thank you. You know that it can get so crazy. Like I'm telling you guys, CNAs, PCTs, when you're a PA, please be nice to everyone who is quote unquote under you or your subordinate, CNAs, PCTs, nurses, whatever, because they do a lot and it could just be very trying. Like they have a very trying job. You can take the test without taking classes. Yes, in Florida, like let me like basically specify that in Florida. I don't know about other states, guys, but in Florida, because that's what I was going to do at a point in time. Just take the test, get the certification, and look for jobs that way, because that's what my friend did. But I ended up finding that hospital that did that, so I didn't need to pay for the test or even do that. And they actually trained me and found me a job. So it was just a win-win. And yeah, that's super lucky of me. I always say that was really God's work. But yeah, it worked out perfectly. Yeah, shadowing is so impossible right now, guys. I know it's super hard. Does a caregiver count as PCE? Okay, so that's another great question. So when I first started looking at PA, they were kind of more laxed on what patient care experience was. Then when I was actually starting to try to apply, that's when they started having more stipulations. So, because at one point in time, I was like, okay, I'm going to do pharmacy tech, because pharmacy tech is pretty easy. The pay is okay, but whatever, I won't have to be a slave or anything like that. But then some schools started to say, pharmacy tech is not necessarily patient care hours, it's health care experience or whatever. Or I would be like, okay, I'm gonna be a scribe because it's super easy to get into a scribe company. And now so many schools are saying that scribing is not patient care experience. So it is getting super hard. I would definitely look at the schools that you're really trying to go to and see what they consider patient care hours before you waste your time or waste your money on something that you don't need to do. I'm trying to figure out how to become a medical assistant. Are you an undergrad student, or how you, oh, this is for someone else. Someone said, this is my first shadowing experience and this has made me so excited. Yes, be excited. This is, we're literally the #1 STEM career #1 healthcare career, so I'm telling you, like, I love being a PA. It has its days, but overall, don't regret my decision at all. What specifically did you do as a labor and delivery PCT? Like I said, what I did was way different than what you will do as a patient care tech on a med surg floor or step down unit or any of those other floors. Like, my job was pretty like basic. So I would basically just be like running around for the nurses, like, okay, she just delivered. I'm gonna go bring her like formula. I'm gonna bring her towels or blankets for the baby. I took vitals. I did checks, which is basically like when you check blood sugar, because some of the mothers would have gestational diabetes, and that's basically when you just get diabetes only when you're pregnant, specifically when you are pregnant at that time. So we would just check their blood sugar levels after to see if it's actually returned back to normal, stuff like that. Because if you don't know, if a person has high blood sugars after their gestational period, then they just end up being diabetic. They just switch over to diabetic, and then you have to probably switch over to medication and lifestyle modification with them. That tidbit. But yeah, anyways, that's what I did as a patient care tech. It was pretty simple. I would do vitals. I would help the nursing staff, help the moms, help the newborn babies. Sometimes I would give the newborn babies a bath. So that would be cute and fun. It was pretty relaxed. Like, I loved switching over to labor and delivery. After that, I was like, okay, this wouldn't be too bad. I probably could do this for a year again, but I ended up getting into PA school. So it was great. I got my dental assistant trade certificate. But when COVID hit, okay, to work as an MPA. So yeah, in the state of Florida, you do not need a medical assistant license to work as a medical assistant. You don't. So one of the things that I was gonna do as well, you guys can also, this is a little gem that I'm gonna give, go look on Craigslist. You guys look at Craigslist in your area, because you'll have a lot of doctors' offices trying to hire people as medical assistants. And some of them, you don't even need a medical assistant license. Of course, be very careful with Craigslist, verify that this is a real dental or medical derm office. But yeah, I used to see like a lot of medical assistant jobs on there, or just patient care experience type of jobs on there. So you should look on there as well. I just started a job doing ENT. Okay. What's my favorite thing about specializing in pain management? Okay, my favorite thing is like, for one, it's kind of like a cool, calm and collective job. Like, some people like being in jobs where it's always fast paced, something's always happening and you're always going, and that's great. Some people like very steady and mild jobs, which I kind of like. Well, I like both. I would do both, but I kind of like, that's the thing I love about being in pain management. It's pretty simple. You still get to do procedures, you still get to meet different people, you still get to, practice medicine, but you're not like feeling dragged on at the end of the day every day, which some jobs do. And I only really experience like any type of grief when I'm dealing, of course, with like patients who are seeking drugs and stuff like that. But other than that, it's pretty like cool selling, and it's still pretty cool because you get to practice medicine but have like a low stress type of job. Did you enjoy FIU? Was it difficult to get into? Okay, so I did like FIU. FIU, I want to say when I applied, there was only 45 people in my class and 1,200 people applied. So 1,200 people applied and only 45 people were accepted. So I guess it kind of is, because that's like, yeah, majority of people not getting in. But that's for every program. It's becoming very difficult. to get into PA school, just because I think more and more people are finding out about PA school. When I started undergrad, which was a while back, my freshman year is when I first learned about PA. And it was like some people trying to do it, but it wasn't that big of a thing, because initially I went into undergrad thinking that I was going to be a pharmacist. But I ended up having this health science class with my major, health science. So they make all of us take an introductory course, which is Introduction to Health Science. So every Friday they would have a different career come and speak and talk and stuff like that. So we would have dentistry, pharmacy, optometry, everything. And a PA came in one day and he's talking about his experience as a PA, what he likes to do, the salary, his lifestyle. And I was like, wait a minute, I might like this. So it wasn't until my sophomore year where I was like, okay, yeah, I'm not doing pharmacy. I'm switching over to PA. And still more people started to do it during that time, but it wasn't as much as now. Now there's like, when I was applying to PA school, I think there were like 5 or 6 PA schools in Florida. There's like 9 PA schools in Florida now. More and more people are trying to do it. So instead of like 1,200 people applying for a school, it's like 2,400 people. Like it's becoming very like demanding. Like so many people are trying to get in. So I think that's why it's getting harder and harder to get into PA school, just because more and more people are trying to become PAs, which I mean isn't a bad thing, but I'm just hoping they do open more schools so more people could get in. But I think now it's like a 6% acceptance rate, not to be discouraging. And FIU was cool. Again, I liked FIU because it was in Miami. So again, I'm one of those people who work, school, none of that can be my entire life. I have to do other things. So I just liked being in Miami. There was always something to do when I did get a chance to do something outside of PA school. So FIU was great for me. What made you choose PA school and not med school? So this is a good question. Like I told you guys before, I have always been around like-minded people. So I was in a pre-med magnet program in high school. Majority of the people who were pre-med there wanted to do medicine, AKA be a physician, whether that's MD, DO. And I never wanted to do that. Like I said to you guys before, I wanted to be a pharmacist. So I never thought of doing a residency program. I never thought of dedicating my entire life kind of to medicine. One of my best friends is a physician right now. She's in her first year of residency. And it's pretty much her entire life. And this is not a bad thing or to bash being a doctor, because of course it's still a great field. Like we need physicians, period. But it's just to say that I told you guys before, I love a healthy work-life balance. And majority of people who become physicians, that is the largest factor of their job, of their life. And it makes sense. They've been trying to become this for 12 years. So they end up working crazy hours. Like my best friend, I don't know if you guys even heard, she was the person texting me earlier. She works like 80 hours a week right now, and she gets paid half of what I get paid. So I just never even thought about becoming a physician, to be quite frank. That's just for me though. It's different for everyone. Have you been able to pay off your debt? If you mean my student loans, absolutely not. Absolutely not. Maybe in a few years, if I was very disciplined, not even maybe, I could in a few years if I was very disciplined. Because like I said before, starting out PA school, FIU wasn't that bad price-wise, but the cost of tuition is getting higher and higher and higher. The year before I started PA school at FIU was $50,000 for their entire program. All 7 semesters was a $50,000 program, which is great for someone who's going to come out of school making 6 figures. Then when I started at FIU, it was like 70,000, which is still not bad for a PA program because it was still cheaper than most PA programs. Now I want to say FIU is like 90 something thousand for the entire program. So I feel like tuition is just getting higher and higher. So it's going to get harder and harder to try to pay off your debt. a year, 2 years, or even 5 years outside of after PA school. My dream school is acceptance rate is 2%. Yeah, the PA profession is getting so saturated that it's just getting harder and harder to get into programs. And I hate that for you guys. Have you ever experienced judgment of poor treatment from a physician for being a PA? Not really. If anything, a lot of physicians have either asked me like, oh, so why didn't you like just go for the whole thing or something like that? Like, you know, very dismissive or passive, like, okay, so why didn't you just become a doctor? But I never really had anyone become disrespectful about it. The only thing I'm gonna warn you guys about, because no one really warned me about it, is that if anything, you're probably gonna have some patience. Why can't I see the doctor? Or, well, if you are like a doctor, why didn't you go to med school or something like that? You'll have like some patients who kind of like snub you. But for the most part, I haven't really met any physicians who been condescending at all. Like, I think physicians are becoming like more and more happy that they have like a PA who they could rely on and stuff. So why did you choose PA over NP school? Okay, a good question too. So like I told you guys before, I went into undergrad wanting to be a pharmacist. So I was already on a pre-med track. And I graduated undergrad in 3 years. And in those 3 years, I was doing organic chemistry, physics, biochem, molecular cell biology, all of these different things. And all of my friends who were in nursing school were like partying and living up their best life. So I kind of was just like, there's no point of me trying to now go do like a 1 or 2 year nursing program and then try to be an NP when I could have just gotten a nursing degree for free and then like went to be an NP. Or yeah, I would have done orgo and physics and all of these difficult classes and go to nursing school that doesn't even require any of these prerequisites. So it just made way more sense for me to go to PA school than NP school, because one, I would have just wasted years of undergrad kind of. And two, with PA, I just love the versatility. Like I'm saying now I'm working in pain management. In 2 months, I could be working in emergency medicine. I could be working in dermatology. I could be doing surgery. I could be doing critical care. Nurse practitioners can't do that. Nurse practitioners are similar to doctors in the way that if you decide that you're going to go and be a neonatal NP, that's what you are. You can't change unless you're going to go back to school and decide that you're going to do psych, or just go back and decide that now you're going to do critical care. They have to get certifications for critical care. They have to get certifications to be a neonatal practitioner. PAs don't have to do that. We are generally trained. So we're trained to do every specialty. So we have more lateral mobility. We're basically able to move way more. So I love that so much more than with the nurse practitioner, compared to the nurse practitioner model. So yeah. How do you handle those patients who would rather see the doctor instead of the PA? I talk to them, I tell them this is my training, this is my certification, and basically let them know that I am just as great and I can take care of them. And if they're still not hearing it, I'm like, okay, I'm not gonna fight you. Let's see if you can see the doctor. Like, I don't think you should fight anybody on it. You should just be content and confident in yourself. Know that you can treat a patient, and if they don't want to see you, then that's fine. Like, it's really not, I don't know. I'm not discouraged by it. I'm just like, okay, that's fine, because there's plenty of people who will come in and say like, I love seeing Fabian the PA. Like, I love seeing the PA. Where's the Black girl that we saw before or whatever? So yeah, I don't really mind at all. Nothing against NPs, but it seems like the PA education is more medicine and science-based. Yes, that is true, because again, NPs learn on the nursing school model. So that basically means that they are more caregivers, and they think more about how they would care a patient versus curing a patient. Sometimes you'll have NPs who can do both, but PA school is more structured after the medical school model. So we end up doing a lot of thinking, and just the way we work really is more so like a physician compared to an NP. And with nurse practitioners, most of their programs are like online. So it's just different because they don't have as much of a clinical, they have clinical experience, especially if they were a nurse first, but their clinical experience is as a nurse and not really as like a provider when we go in our clinical year. So that's the difference too. Yeah, so yeah, someone said that, yeah. I believe NPs are trained on the nursing model. Yeah, right. What was your view on diversity as it relates to the PA profession? Diversity as far as like race, because I can tell you now that it's not really that diverse. I think it was only, for me, I'm just going to speak on me because I'm Black, obviously, but it was only 3 like Black people in my class. And yeah, so, and I want to say it's only like 3%, like less than 1% Native American, 3% African American, and then I forgot the other percentages, but it's not necessarily that diverse, and a lot of programs aren't really that diverse, if I'm being honest. How did you gain shadowing hours? So I gained shadowing hours again. I feel like I was kind of lucky. One, after I did my internship at Florida Hospital, I met PAs and DOs there. So I just asked to shadow them again after my internship was over. So that was one. And then 2, when I started working as the patient care tech at that hospital before I got switched to labor and delivery, like I told you guys before, I was in med surg. So a cardiothoracic PA ended up coming down one day, and he and I was like, oh my gosh, he's a PA or whatever. So once he came out like a patient room, I kind of like stalked him and was like, hey, and I introduced myself and was just telling him, and I was like, yeah, I just really want to be a PA. Like, I want to apply to PA school. Like, do you mind if I shadow you? And he was like, of course not. Like, my daughter's trying to apply right now. Like, I know how hard it is. So I ended up finding someone at the hospital that I worked at. So it was perfect because I already had privileges at that hospital. He was in a different specialty that I'd never shadowed in before or saw before. So I ended up getting shadowing hours from him as well. So that kind of fell into my lap too. So like I said, it kind of was easier then than now, because it's just hard with COVID to even be in the hospital if you don't work there. I have worked with a lot of fantastic NPs in the emergency room. Of course, like I said before, nurse practitioners are bomb. Like, I'm never going to say it to knock nurse practitioners at all. It's just the fact that someone asks, like, what's the difference or why I chose one over the other. But nurse practitioners are great. Do you have any opinions on the name change for physician assistants? Oh my gosh. Yes, I don't have any opinions, but I do think that our name should change. I think a lot of people, like, either some people don't know what we are. Like, I will meet some people and they'll ask me, oh, okay, so what are you? And I'm like, oh, I'm a PA. Okay, so you're like in public administration? I'm like, no, I'm a physician assistant. And they're like, oh, so you're like, working for the doctor? And I'm kind of like, and then I kind of have to explain. So I do think that we should have a name change. I just don't know what the name change should be. The suggested ones that they put out, I didn't care for really any of them, but I don't know. Maybe physician associate, that's what they call them in the UK. But again, that still has like the physician name attached to it. So I don't know. Sorry, I have to charge my laptop. So yeah, so I don't know, but definitely think they should change the name. Okay, CTPA is my dream gig. Okay, that is great. I would suggest that To be honest, I've seen new grads get into cardiothoracic surgery. You probably have to move from your area if you're in like a big city, but I've definitely seen new grads get into cardiothoracic surgery. So I hope you get in it. Can you talk about letters of recommendation? Okay, so my letters of recommendation, one came from my anatomy professor. He was also an MD. Another came from the cardiothoracic PA that I shadowed. And then the other one was from my nursing manager. So I just tried to choose from different areas of my life, because my anatomy professor would be able to talk about like my scholarly academic type of personality, I guess, or characteristics, and then my shadowing experience, and then my actual work ethic from my nurse manager. So that's who I chose to do mine. But if you could get 2 PAs and an MD, or 2 MP and 2 MDs, whatever, just try to get someone to do it. Don't be afraid to ask. The worst thing they can do is say no. So just go ahead and try to ask. Make sure you're asking correctly though. If you need to write an email, if you need to write a letter, if you need to speak to them in person, just make sure you're really like authentic. And also it's best to, of course, to try to get people who actually know you. So if you took anatomy 4 years ago and your professor doesn't even remember you, that's probably not going to be your best letter. So try to get people who really know you, who are I guess your superior, and who of course get at least two who have like some type of clinical degree. MCP, oh, I think that was the name change. How does one deal with rejection with such low? I'm gonna be completely transparent. I was rejected. I told you guys I applied to 5 schools. I was rejected from 3. And 3 of which were all they're the same school, but different campuses. And and this was before I got my acceptance. So I was just like, oh my God, like I'm going to have to apply this next cycle. Like I'm going to have to be a PCT for another year. So I kind of like, I'm a person who wallows in sorrow, like for a little bit though. And I always do that just so I can go through the motions and get over it. And you honestly just have to keep pushing. Like I said, this is going to be difficult. Like on the road to becoming a PA is stressful. It's going to get hard. It's difficult, but you just have to like really just know that you're destined to do this. So it's not going to be peaches and cream. I told you guys when I was like on that med search floor, I was like, yeah, they could forget it. Like, I don't even need to be doing this. Like I have my bachelor's, I'll figure it out. I'll do something else, but you have to really like push forward. So again, that's finding like the good friends and family who motivate you when you don't have motivation yourself. I heard it's so hard to get in as a new grad. It kind of is, but like I said, I know several people who have done it as a new grad. You really just kind of have to network or move out of a large city and go somewhere else where they're willing to train you. How long did you shadow the PA before I asked for a letter? A month. Because I wanted to get in my letters and everything in CASPA. So I was like, okay, a month is not that long, but he knows that I want to be a PA because was the main reason I was shadowing him. And his daughter wants to be a PA, so he must know, like, come on. So literally I just waited a month, and I think he knew me well enough because we had a good conversation. So you should just try to feel it out. And see if you think that you're close enough to that person to ask them a letter, whether it be in a month or 3 months or whatever. But I did it in a month because I needed that. Was your GPA good since 500 isn't a lot? What was I going to say? I guess my science GPA was a 3.6 and my overall GPA was a 3.7. So I guess that's good. Yeah, I don't know. Yeah. I currently work as a CNA. Do you recommend me becoming an EMT? I could learn more and advance my skills. I mean, if it's not going to cost you anything, because if you're doing the EMT just for your end goal to be PA schools actually look at CNA as patient care experience, unless you go to the schools that you want to go to and they're telling you on their website they don't. But all the ones I've seen say that CNAs actually do count as patient care experience. And yes, you will advance your skills, so it'll be better when you're doing like clinicals and for didactic. So I guess you will have a better, like a leg up a little bit, but I don't think it'll make a difference in whether they view it as better patient care experience, should I say that. Can you use the same recommendation letter references even if you get rejected the first round? Yeah, I mean, yes, of course you can, because they can't really tell you anything, and I doubt they would even remember that this was the same letter of recommendation. If you do not get into PA school your first time, can you reuse your letter? Yeah, so same question, yes. Do you think shadowing an NP or MD is also good shadowing experience? Yes, I do, because you never know until you shadow any of these people. Oh, I actually do want to be a MD. Maybe I actually want to go this route. Or you can still, because I actually was going to make one of my letters of recommendation, one of the MDs that I had my internship with at Florida hospital. So you could also end up having the MD write your letter, which looks good as well. So, or you can also have that MD in your back pocket for when you get out of PA school, and you can like hit them up and say like, hey, I finished PA school. Like, you have any jobs for PA? Would you like a PA? So I think it could work out for you shadowing a NP or or MD. And of course, shadowing a PA too, because you want to see if you actually want to do this. I've heard that they prefer PA. It depends. Some doctors prefer PAs, some doctors prefer NPs. Why? In some states, NPs have way more autonomy. So if you're in some northern states, they have things called a delegation agreement. And that's when you basically have to get an agreement that you're getting a supervising physician to kind of watch over you or be a supervisor for you in the field. Versus in Florida, after I got my license, I didn't need a delegation agreement. I could just start working right away. Like, it didn't matter. So some places like NPs, because they either already worked as a nurse. So like, let's say a pediatric hematology job has opened up, and they can choose a nurse practitioner who worked as a pediatric nurse, or a PA who just who's never worked in pediatrics. They're going to be like, okay, yeah, they're both basically do the same thing, but this person at least has some type of background in pediatrics. And then some people will be like, oh, well, I want the PA because I know the PA is going to prescribe like me. I know the PA is going to think like me. I know the PA, they can work in the OR and they won't need a critical certification like the NP does. So it all depends. What's your opinion about reapplying to the same school? I say if you really want to go to that school, go for it. Because some people get in the second time they apply to that school. And some schools see like, okay, this person reapplied, they changed this, that, they become a better applicant, you're in. So I'm not opposed to you applying to the same school twice. Yeah, CASPA is basically the application system for majority of PA schools. Some PA schools do paper applications still, or separate applications, but for the most part, all the schools I wanted to go to were on CASPA. And yeah, are there any more questions? Let me see. Okay, so did I answer majority of the questions that needed to be asked? Did anybody else need to ask anything?
Yeah, I think you did a great job. I had a few just, comments written down here.
Okay.
So, yeah, I mean, amazing presentation. You did, I mean, it seems like you do this all the time. You have such a great personality for it. Like, you're so confident when you talk, great personality, very bubbly. I like how you were like, oh, well, I don't want to say I do what I want, but you know, I do what I want. Yeah, that was awesome. You did a great job of being very inclusive to everybody. You know, obviously we reached to a wide range of diverse viewers, you know, like people who are just graduating high school, people who have been out in the field for a long time. And you were awesome about including everybody, talking about people with different levels of education, you know, kind of explaining the little details. So definitely appreciate that.
Thanks, guys. Thanks. Oh, I think, let me answer this last question.
Oh, yeah.
Yeah. Okay, so wait. So, okay, so this person says, do you have an opinion about PAs from DO programs versus MD programs? I ask because pain management makes sense with the holistic approach. No, your pain management physician who trains you could be either DO or MD. So I don't think it matters whether you go to a program that is either or. Like, it doesn't matter at all. So yeah. And okay, so yeah, I think that was pretty much it, guys.
Yeah, that was amazing. Oh, sorry, go ahead.
Oh, I was saying, and what notes did you want to go
Oh,
over?
yeah, I mean, just a million compliments that I have that we wrote down throughout this. Everything was awesome. We really like how you talked about drug abuse. I know it doesn't really highlight your field, but it is kind of an important consideration. So that's really cool that you're able to be kind of transparent and talk about that kind of thing.
We also love that you emphasize listening to patients. That's a huge deal for us as well. And it really does reveal quite a bit. So
yes.
Yeah, I mean, it's always so impressive listening to you guys talk. Like, you're so like detailed in everything that you do, like your diagnosis, you know, how much experience you have, everything you listen to. It's so impressive. And it's just, you know, kind of one of those things where it's like, man, I want to be like that one day. So this is awesome to see it.
Thanks, guys.
Yeah, absolutely. And kind of in regard to what you said about, you know, everybody gets kind of derailed, you know, discouraged at some point. Something's going to happen. You're going to end up on Reddit and then look at the forum and say like, oh God, this guy has 4.0, 5,000 PCE, you know, but things like this, I feel like, you know, for me, they do a good job of kind of reinvigorating me, you know, like when I go on and watch a PA talk, it's like, okay, I'm remotivated. Like I need to do this. You know what I mean?
Right.
So, especially somebody like you, we can tell that you love what you do. You're so good at it. You know, you love talking to people. We really appreciate you taking this opportunity to give back.
No, I loved it. You guys are doing great work. Like, it's amazing. Everyone really does need these shadowing hours. So you guys are amazing. So thanks so much for having me. And thanks for everyone who's asking questions. I love answering questions because I was just like this when I was trying to get into PA school. So thank you guys so much.
Yeah, absolutely. It was definitely our pleasure. Thank you. And once again, guys, we have that Instagram up for you to click it. We definitely recommend that you follow. We follow, and it's really cool. A lot of good PA information that comes through there.
Right.
All right. Well, thank you so much. We hope you have a wonderful night, and we really appreciate you doing this again.
All right. Thank you, guys. Everyone have a great night.
All right. Take care. Thank you again.
Bye.
You too. Bye.
Okay, everybody, that was a really good session. Thank you so much for joining us. We're about to post the quiz in the chat right now. We have so many more PAs coming through. God, every week we're gonna have at least one session. We're gonna have some really cool ones coming up, so stay tuned. We will advertise on Instagram so that you guys can kind of have an idea of what's coming up. We definitely have one for next week, the following week. I think all of February we're like fully booked, so really good opportunity for you guys to, you know, ask your questions about you personally, learn all of this stuff from very experienced, diverse group of PAs, you know, from different background, different specialty, all sorts of stuff. It's gonna be really cool. God, I'm trying to think.
Oh gosh, February 6th. Okay, so next week, February 1st on Monday, we have another session. We're, like we said before, we're trying to do one a week. And it's going to be an OBGYN PA. A lot of people requested that in the feedback, so we actually have that coming up. We'll be making that post soon. And then the week after that, we do have something else, but I wanted to mention the conference that we shared. It'll be through our YouTube channel. So if you want to get notified, you can hit like the little subscribe button and turn on the little bell so you know when we're going live. That'll help for future sessions too if you forget. But yeah, the conference, it'll be February 6th, starts at 8 a.m. Pacific. So if you want to join that.
Yeah, that'll be a really good, interesting thing. It's going to be something like 8 hours long, straight pre-PA information, not organized by us. We're just kind of helping out behind the scenes. I think majority of it was organized by Scalpels
Ariana and Sato from Sparkles and Scalpels on Instagram, and then Hard Work Pays Off on Instagram.
Yeah, so stay tuned for that. We'll be talking about that. But yeah, guys, so the quiz is posted. You guys have any questions, we'll be right here. Thank you so much for everything. You guys are awesome. We love everything we see in the chat. We love all the awesome DMs we get. You guys are amazing. It's just such a privilege to be able to serve this type of community. Like, we really, really, honestly, you know, bottom of our heart, wish everybody the best of luck. I know the application cycle is coming up for a lot of people, and even for the ones that want to apply in the future, like, just, you know, best of luck to you. Stay confident. You're awesome. You can do it. But yeah, guys, we'll be right here. If you need anything, just let us know. Thank you so much again. You all have a great night.